What I want to speak about, or talk about, is a little bit about certification in age management medicine. What are essential qualifications and knowledge base for those of us who do this type of practice? Full disclosure, I've developed and I run a training course and a certification course. Everything I'm going to say here is just my opinion, okay? Just what I think. But hopefully I'll explain a little bit about why I think this is important. And, if you're thinking about some specialized training in age management, what I think the type of training should entail. So we'll go ahead and just get started. Well, first, what is age management medicine? I mean, we come to a conference, we talk about age management medicine, but it's really not specifically defined. And I suppose it would depend on who you ask. Hormone optimization, nutritional counseling, exercise prescription and management. There's certainly a preventive medicine aspect. Chronic disease management, even though a lot of us think of ourselves as wellness practitioners, we do interface into chronic disease management, I think in a very good way. Nutriscriptives are a big part of many practices. There's, complementary and alternative medicine, and frankly, I don't know what the hell that is. It could mean almost anything. And then there are emerging therapies, stem cell therapies, telomeres, epigenetics, genomics are all going to be new frontiers that are going to interface with what we call age management medicine. Therefore, defining what makes one qualified to practice is really difficult. There are no current residency programs. There's none of our medical schools and residency programs are training in age management. There's no currently accepted board certification, and I doubt that probably in my lifetime we'll actually see one. The reason for that is that that's going to require certain of our other medical boards to cede some of their turf to a new board. That's something that's probably going to be resisted quite vigorously. The gynecologists aren't going to want to let go of hormone management for women. The endocrinologists certainly don't want to let go of hormone management at all. The urologists are going to want to stay primary and androgen replacement therapy. So, and since we interface in terms of lipidology, cardiology, diabetes management, there's going to be a lot of resistance to creation of a new board. So I think one day that'll change. As I said, I don't think it'll change in my lifetime, but eventually it's going to be necessary. So the one thing is it's really hard to be a true expert in all those areas. We're really vulnerable to having our knowledge base be a mile wide and an inch deep. And having practiced in this area now for a few years, that's one of my main concerns when I developed the training course, is that because we so broadly touch on so many areas, that we tend to know a little bit about things, but we really don't know it at the expert level. And I think that that's got to change for us who are, merging into this field and kind of setting this new paradigm approach to how we take care of patients. So it may be perhaps wise for us to limit ourselves to a few of these areas and really develop expert knowledge in a few of them rather than trying to be all things to all people. Now, in the future, I think we will see resident training programs in age management or preventive medicine. I don't know who's going to take the lead in that, but I think that certainly this will happen. But the big question is, where will the experts come from? How does one deem themselves an expert in age management? I don't really know the answer to that. I think that there's a good chance that some of the experts are going to come from those of us who are sort of pioneering this approach and out there practicing it. And I hope that the residency programs, when they start to think about, tap into the wealth of knowledge that's here among a lot of the people that are here at this conference, both attendees and the people who are speaking. So rather than try to define, what age management is, perhaps it would be better to say, well, what do our patients need? Now, again, these are just going to be my opinions. This is what I think the patients need, again, based on, my philosophical approach and my experience in practicing this type of medicine. Well, this is what they need. This is what America needs. They need lifestyle management. Okay, we got to do something with this guy here, and let me tell you, he is a hard fix. We've got a nation full of people like this, and they're going to cost us obviously billions of dollars to treat. We're going to have a lot of these people in very low quality lifestyles for a long period of time because, over the course of my career, and those of you who are about the same age, what we've done very well is we've learned how to keep people alive. And we're getting pretty good at that, but we're keeping them alive in very low quality lives. And I think that part of the reason there's a search in our patients for something different is because they're beginning to realize that that's not necessarily a good bargain. All right, so lifestyle management, what does that consist of? Well, the number one thing is nutrition. So I believe that nutrition is the single most important aspect of one's wellness. I tell the docs who come out to train with us is that if you could only choose one thing and one thing only for your health and wellness, you would want to choose a superior approach to nutrition. That would do more for a well-lived and long-lived life than anything else you can do. The trouble with nutrition is it's very difficult to figure out what's going on. It's a polyvalent system. It's difficult to study because you really can't really control what patients intake nutritionally for periods of time beyond maybe 1, maybe 2 weeks at the most. So when you're not going to see the randomized controlled trial, it really doesn't suit nutrition well. We can maybe lock people up for 10 to 14 days, feed them specifically, a certain thing, but then we only can see what happens in that very short period of time. When you get into free feeding humans, all bets are off. And what you'll notice when you read the nutritional literature is that the entirety of the literature is almost all epidemiology.